Today we'll explore how peer support and professional treatment each play a role in addiction recovery and why combining both might be the most effective solution.
The problem. In 2023, there were more than 46 million adults living with an SUD, or a substance use disorder. That's nearly 1 in 5 adults. The impact is huge. Altogether, addiction costs the United States around $2.7 trillion every year, a figure that includes healthcare expenses, lost productivity, and social costs. This shows that addiction isn't just a personal problem, but a national crisis that affects families, communities, and the economy. However, there have been many areas of research to help with this problem. For example, peer-led recovery programs have shown lots of potential in some research fields. One study found that peer support can lower relapse rates, strengthen relationships, and increase overall satisfaction with treatment. But recovery isn't just that simple. There's no single solution that works for everyone, and that's why today we're going to look at 2 major approaches: peer support groups and professional medical interventions, and how each one plays a role in helping people recover.
Solution 1, peer support groups. Peer support groups are recovery spaces led by people that have lived through addiction themselves. These groups focus on shared experience. Members connect over what they've been through, which builds trust and hope in ways clinical settings can't. Studies have shown that peer support reduces substance use, increases treatment retention, and improves relationships with providers. One source says peer specialist positions help clients achieve long-term recovery by connecting them to their recovery community. The benefits are clear. They're low-cost, community-driven, and emotionally supportive. But there are also limitations. These groups don't provide medical care like detox or medication, and their results can vary depending on leadership and funding. Some peer supporters may even struggle emotionally when discovering their own past traumas. So while peer-led groups are a vital piece of recovery, they can't always meet the medical or mental health needs of everyone. That's where professional intervention comes in.
Solution number 2, professional interventions. Professional interventions include counseling, behavioral therapy, and medication-assisted treatment, or MAT. These approaches combine therapy with safe medications to help people manage addiction and withdrawal. According to the National Institute on Drug Abuse, addiction is a treatable disorder. There are safe, effective medications and psychotherapies for treating substance use disorders. The advantage of professional treatment is its medical accuracy and proven effectiveness. It's especially vital for people with severe addiction or co-occurring mental health issues. However, there are clear limitations. Many people can't access or afford these programs, especially in rural areas. There's also stigma. Some avoid treatment entirely because they're embarrassed or they just distrust the system. And even when treatment works, the social support often ends when the program doesn't. That's why relapse rates can still be high if there's follow-up community support. While professional intervention is medically approved, it is not good for somebody's social life.
When we look at the evidence, the best solution isn't choosing between peer support and professional treatment, it's combining them. Peer support groups provide ongoing community connection, while professional care ensures medical safety and structure. The 2 approaches balance each other out. The Substance Abuse and Mental Health Services Administration, SAMHSA, says peer support services can effectively extend the reach of treatment beyond the clinical setting into the everyday environment. And medically, studies show that these medications are linked to dramatically lower overdose deaths. This combination tackles both sides, the human side and the clinical. It's also realistic. Peer support programs are low cost and scalable, while medical interventions can focus on those with the most severe needs. By merging them, we make recovery more accessible, compassionate, and sustainable. Now on to Leo for the conclusion.
So, our conclusion. To wrap up, addiction recovery isn't just a one-size-fits-all problem. Millions of Americans are affected, and the most effective strategy is a combination of both peer recovery programs and professional interventions. This leads to a collaboration between medical professionals, peers, and communities. By combining evidence-based treatment with peer-led support, we can reduce relapse, improve recovery outcomes, and rebuild lives. Recovery takes both expertise and empathy, science and community working together. This is our work session.
2 slides, images, and then. Thank you.